Most forms of therapy, particularly those that have come out of cognitive behavioral therapy, are focused on trying to help us change the way that we see ourselves and the way we see the world around us. And it can be a very effective form of relieving symptoms. That cognitive therapy, sometimes called schema therapy, can help us have a better outlook on who we are and a more pleasant view of the world around us. A lot of times we're not ready for that type of work. Sometimes where it's just our body is sending danger signals. So when we're trying to change the way that we see, the body's saying that's not safe. It can be neurological. Our brain is so alert, we're like on a watchtower because of the pains that have hurt us in the past. The traumas that we've been through before tells us that we still need to do the protective things that we've done before. We still need to have the protective ways of thinking that we've done before. And that's when other types of therapies may be used. One of the type of things that we know help decrease that alertness are therapies that do bilateral stimulation. EMDR is a form of doing that. ART, anything that is using a bilateral, either tactile or visual method, can help us get out of that back part of our brain that is so wired to be either to fight or to flee or to placate or to be frozen. How do we leave that part of our brain and get a little bit more forward and have a more accurate view of the actual risk in front of us? When we use bilateral stimulation, and we here at Family Solutions Therapy do work with a company called Brain-Sculpt. They're out of Logan. They're here in Utah. And they make what they call the Brain-Sculpt pulsers. This is an example of them. And you can either hold them like this in your hand, you can put them up over your wrists, or you can put them around your ankles if you like. And we have an app that we can use to control the speed and the intensity so it feels right for you. But what these do is that they are telling us physically a reminder: left, right. The loudest voice in our mind is often the really alert one. The loudest voice in our mind is often the one that says, this is dangerous. And then we have those options of fight, flight, freeze, or fawn. When we are doing left and right stimulation, we still hear that loud voice in our mind, but there's an invitation. These invite us to maybe use our right brain, our left brain. Our cortex has a right brain and has a left brain. That's the invitation, is can we notice what that part of our brain says about the risk, the danger. So this is a way to help us maybe be able to hear the smaller voice in our mind and be able to then do some more cognitive therapy, whether it's acceptance commitment therapy or dialectical behavior therapy, to actually try on some new ways of thinking. So if you're finding that psychologically or neurologically you're so alert that you're feeling stuck in the changes you're trying to make, maybe you come in and try some bilateral stimulation here in the sessions and even outside of the sessions, and see if that helps you notice the opportunity to actually start to change the way that you see yourself and the world.